The Ontario government will stop collecting COVID-19 numbers from school boards and suspend reporting of new coronavirus infections amongst students and staff. The Ministry of Education announced the change in a memo to school boards on Thursday, the same day the province announced the resumption of classes would be delayed by only 2 days. School and childcare closures due to outbreaks will still be reported. All right, for more, let's go to infectious diseases specialist, Dr. Isaac Bogoch. Dr. Bogoch, first of all, good morning to you. Happy New Year.
Happy 2022. I hope this year is a lot better than last year.
Fingers crossed, Dr. Bogoch. You know, a lot of news coming out that really does have a lot of people worried to start off 2022, though. Let's begin with what we heard from Ontario, that memo, that the province is going to stop collecting COVID-19 data from school boards. This is coming as we're hearing from many teachers that they're not confident that enough is being done to prevent the spread of coronavirus, of COVID, variants like Omicron in schools. What are your thoughts on this?
I'm not a fan of that. I think transparency is key. We need to know, what degree COVID is infiltrating the schools. I think that might also influence some parents' decisions as well to have their child in school. Transparency really builds trust and confidence, and it's okay to say things are going well. It's also okay to say some things are not going well. But, having more information is always better than having less information. It can enable decision making on behalf of parents and everyone involved with schools. So I'd much prefer to see those numbers than not.
Let's extrapolate that, though, to the broader community, to the province as a whole, because PCR tests are going to be limited to the most vulnerable. Asymptomatic students and teachers, they can still apparently get access to PCR tests as well. But how are we going to be able to know now when the spread of the virus has peaked if we don't know how many cases there are in the community at large? Are we going to have to rely on hospitalization data as our key indicator here? What's going to happen?
Yeah, exactly. I think there's a few points. This is slightly different than the school environment. I mean, when you have a limited resource, in this case, testing, I think it's really important to focus those resources where you need it the most. We're going to need to beef up testing for vital sectors like schools, like healthcare workers and other sectors of the economy that need to stay running. So you really have to focus those limited resources. Listen, in a perfect world, we'd have enough testing capacity to test everyone under the sun, but that doesn't exist. So, it does make sense, I think, to focus those limited resources to areas that need it the most. But as you point out, that comes at a cost, and that cost is we're flying blind in the sense that we just don't know what the degree of impact and burden COVID-19 has in various communities. Still, I mean, it's safe to say that it's high. And when you have so much COVID in the community, I think from an individual standpoint, if someone has signs or symptoms compatible with COVID, regardless of how mild, it's fair to say that there's a pretty reasonable likelihood that it's COVID and you should stay home for 5 days. But of course, it would be a lot better if we had some roadmap, some indication of how much COVID there is, and we'll be relying on other indicators like hospitalizations, ICU capacity, and other metrics instead.
So, Dr. Bogoch, PCR tests are in limited supply. Rapid tests, those were tough to get a hold of. If you couldn't stand in one of those lines or if you don't have the means to order them online, there's even a delay there. But if people do have rapid tests, they don't have a lot of them available to their households, so they're probably going to be trying to conserve the use of them. When is it the best time to test to see whether or not you are positive for COVID-19? Like what number of days after your symptoms pop up or that you suspect you had an exposure to a possible case?
Right. There's a few good times to use these rapid tests. I mean, on the one hand, some people might want to confirm if they have COVID-19. And again, rapid tests aren't perfect, but they're still pretty good. So if someone has compatible signs or symptoms with COVID-19, you can do a rapid test right then and there. And, if it's positive, you're obviously positive and you should treat that as positive, but you don't actually have to do a rapid test. I mean, I think it's fair to say right now, today in Ontario, if you have signs and symptoms of COVID-19, you can just acknowledge that it's very well likely that it's COVID-19 and not use that rapid test and just say, you know what, I'm gonna lay low, I'm gonna stay home for those 5 days. But on the other hand, too, I mean, if people are completely asymptomatic and for whatever reason, if you're having small gatherings and or other, you want to create a safer indoor space. If everyone has a rapid test and does the rapid test and tests negative, you have an added layer of protection. Again, I can't stress this enough. The rapid tests aren't perfect. They're just helpful. And it's an additional tool to create a safer indoor space, especially if you have several people coming into that indoor space. Of course, you've got to have masks, ventilation, crowd control, right? Vaccination with dose 1, dose 2, dose 3, if you have access, or if you're eligible. So, there's lots that we can do to create a safer indoor environment, and rapid tests are one of several components.
I did want to finally ask you, we only have a little bit of time left here, a few seconds, but there is a difference in the approach that we've seen amongst the two provinces that have seen the highest number of cases, Ontario and Quebec. In terms of restrictions, in terms of trying to deal with the spread of Omicron in each province, Quebec has closed indoor dining, for example, no gatherings in households with another family. Basically, there are limits there. We're not seeing the same in Ontario yet. Do you expect that move to come soon?
I'm not a betting person, but I mean, when you start to see a rise in hospitalizations and a rise in ICU cases, as we're starting to see, as is expected, and when you put that in the context of a healthcare system that was stretched thin even before this wave started, I wouldn't be surprised if we see additional measures in Ontario. Maybe it's not going to be the same as Quebec, but I wouldn't be surprised if we see additional measures in Ontario. Let's see. I mean, these ultimately end up being political decisions, and we'll see what pans out in the week ahead.
All right, infectious diseases specialist Dr. Isaac Bogoch, thank you as always, and Happy New Year to you.
Happy New Year to you as well.